Safe sleeping practices are extremely important to minimise the risk of injury to your baby and sudden infant death, also known as cot death. There are some known risk factors associated with unsafe sleeping practices. We know it is easy to fall asleep holding or feeding your baby. Whilst you are in hospital with us, we ask that you please ensure that your bed is lowered as much as possible to minimise the risk of injuries to your baby if your baby were to fall. Do not sleep with your baby in your bed. Put your baby back in his or her cot when feeding is over. If you need help with putting your baby down, please call a member of staff who are always available and happy to help. The following are the best practices in hospital and at home. Ensure baby sleeps in a suitable cot or crib with an appropriate mattress which is firm and flat. This should be in the same room as you for at least the first 6 months, and you should aim for a safe room temperature between 16 and 20 degrees Celsius. Babies should be placed in their cot on their back with their feet at the bottom of the cot to sleep. Never put baby on their front or side to sleep. Quilts, duvets, pillows, cot bumpers, nests or toys are not recommended in the cot. Any bedding should not be able to cover the baby's head. Do not let pets share baby's sleep space. When holding your baby, make sure that you can see their face and their neck should be straight with their head upright so they can breathe easily. Be aware of your baby's temperature, especially if using slings to avoid overheating. We do not recommend swaddling for the same reason. Babies do not need to wear hats indoors. Check the baby's temperature by touching their chest or back. Hands and feet will always be slightly cooler. Babies should not be left to sleep in car seats for long periods. It is therefore a good idea to take regular breaks on long car journeys. Babies are not recommended to be in their car seat for longer than 2 hours at a time. Do not allow anyone to smoke around your baby. This increases the risk of SIDS. If anyone does smoke in the household, it is recommended for them to smoke outside. We do not recommend it, but some parents choose to bed share with their babies. This means that their baby shares the same bed with an adult for most of the night, and not just to be comforted or fed. Baby should sleep in a clear sleep space which is easy to create in a cot or Moses basket. We know, however, that families also bed share, and so recommend making your bed a safer place for your baby, whether you doze off accidentally or choose to bed share. Keep pillows, sheets, blankets away from your baby or any other items that could obstruct your baby's breathing or cause them to overheat. A high proportion of infants who die as a result of SIDS are found with their heads covered by loose bedding. Make sure baby won't fall out of bed or get trapped between the mattress and the wall. Hospital beds are not designed for bed sharing. Bed sharing should not be done whilst in hospital. Please use the cots provided. It is important for you to know there are some circumstances when co-sleeping with your baby can be very dangerous. Either you or your partner smokes, even if you do not smoke in the bedroom. Either you or your partner have drunk alcohol or taken drugs including medications that may make you drowsy. If your baby was born premature before 37 weeks. If your baby was born at a low birth weight, 2.5 kilograms or 5.5 pounds or less. Never sleep on a sofa or armchair with your baby. This can increase the risk of SIDS by 50 times. You should never sleep together with your baby if any of the points apply to you or your partner. A good source of further information and advice can be accessed on the Lullaby Trust or UNICEF websites.